welcome to the next edition of the Academy by Acclivity Health Solutions. Today, we're going to follow on from our last discussion, which was around value-based care readiness, by jumping into one of the toughest concepts for most organizations to build success around, which is how do I contract in this space where the reimbursement model is shifting and the landscape around me is taking shape in unfamiliar ways, and shifting is occurring very quickly. I would say in the last 8 months to a year, we've seen more market movement than we've seen in the last 5 years. And I think that trend of folks coming together to solve this problem in communities where they connect to one another, build networks, measure network performance and adequacy, that kind of scenario is only going to continue to accelerate and multiply. So let's talk a little bit about how do you first get ready for understanding that you have a network around you starting to shape itself, starting to include participants that might be competitors to you, really starting to find its way as it measures and manages, alternative payment model success, value-based care success. So what we often would describe to folks, and this is a value-based care readiness assessment for one of our current customers that actually have their model of care around advanced illness inside of the New Jersey state market. And when you think about that, you need to have a survey in your mind of who's the participant organizations you might want to partner with under some arrangement to chase more revenue capture from aligning to quality, cost, utilization, the kinds of measures that matter in value-based care. So the first thing you can look at is, well, okay, the single largest federal example of alternative payments under value-based care are the Medicare Shared Savings ACO. So by market, in this case, the state of New Jersey, how many of these organizations that are known entities, that are public facing, that are, that you can see real clarity about how they perform, the size and scale of their operations, who participates with them, what kind of network exists. You can see this is a fairly substantial list for that state, and this is the same across almost all 50 states. There is a significant and real opportunity for you to participate. So this is a look at that kind of opportunity, just measuring ourselves and the real potential we have against Medicare Shared Savings. The second part of what you should be mindful of is Medicare has multiple models. So in this particular organization, we're literally looking at not only the models related to traditional Medicare Shared Savings, we're also looking at them related to REACH. And again, there's a number of organizations that participate in the markets where this particular organization wants to align to those networks. Fairly substantial list here. And lastly, again, thinking aged adults where most of this opportunity to play exists, here are the MedAdvantage plans by name and number of enrolled persons in the different markets that this particular organization serves. So it becomes pretty impactful when you start surveying your market. It becomes pretty impactful when you start seeing what the opportunity is. Just like any organization that takes a product to market and puts it on a consumer shelf, you have to package your model of care. You have to understand how you might price this. You have to understand what avenues you might be willing to contract under: joint venture, participant arrangement, preferred partner arrangement. And if you don't understand that in your own world, you're going to look less than optimal for these organizations that are picking partners to dance with, sometimes for the next 3 to 5 years. So get smart in how you're going to contract, get smart in how you're going to manage and measure your model of care for improving outcomes, and then make sure you show up for those initial meetings, being able to carry the water, because first impressions matter. Have your quality measures and metrics known, have your pre and post or your control group improvements known. And if you need help, obviously, organizations that we've mentioned in our previous conversations, folks we're bringing into our podcast will be able to also help you with this. Acclivity can raise our hands and play a role in this space as well. But be mindful that there is an opportunity to get really smart about your market and to tackle as much of the opportunity under value-based care that you possibly can. Again, thanks for your time. If you have questions or you want to ask us about including other information into our Academy content, info@acclivityhealth.com. Thank you much. See you soon.